treatment of dementia depends on what the cause of it is, and there are some medications that we can use for Alzheimer's disease. And if someone has post-stroke cognitive impairment, then we make sure that people are on the right medicines to reduce their risk factors for having another stroke. Other ways to help treat dementia is to help patients and families understand what their diagnosis is and how to treat it best. Understanding that if your parent is not recognizing that they said something, it's not because they're trying to be difficult, but could very well be because they really didn't remember saying that. Medications for Alzheimer's disease specifically are the most well-known ones are anticholinesterase inhibitors, so medications like donepezil or Aricept. And the goal of these medications is to help stabilize and slow down memory loss. Nothing cures the disease itself, but what we're hoping to do is to slow down decline as much as possible. People that are diagnosed with dementia have very unique journeys ahead of them. We like to say that if you've met one person living with dementia, you've met one person, because everyone's trajectory is a little different. Unfortunately, we can't give a good prognosis and life expectancy because it is so different for everyone. Sometimes people will live with Alzheimer's disease for many years, and then other times, it can be very rapidly progressive. It's really difficult to give a prognosis, and I know that that's really frustrating for families. What I do like to tell families is that the goal is to help your loved one be the best they can be for as long as they can be. And this is how we're going to do it. Whether it's through medications, meeting with our memory care clinic team to get connected with community resources, senior navigation, all the things that can help improve day-to-day life.
As with any condition, even a broken leg, the treatment for the broken leg is the cast. But the person can have pain with their broken leg, so you give them a pain medication. The patient may need crutches, so you give them physical therapy. They may get depressed, so you give them an antidepressant because they broke their leg. In patients with Alzheimer's, there are many symptoms. You have behavioral symptoms, there is agitation, there is depression, there is anxiety, there are sleep disturbances, there are hallucinations. We have always had treatments for the symptoms of the dementia. We also developed over the years treatments that can help enhance memory transmission. And these are the medications that people hear about: Aricept, Exelon, Namenda or memantine. These medications enhance the neurotransmission in the brain, but they don't really fix the process of brain death. More recently, in the last couple of years, we may be on the cusp of developing medication that target the pathology or the processes that are happening in the brain that potentially contribute to the dementia. And that's a tricky issue. We still don't know exactly the mechanism of how Alzheimer's disease developed, but when we have looked at brains of individuals with Alzheimer's disease, we see these protein tangles and protein deposits. We now can target these protein deposits and in some way dissolve them or demonstrate that we're removing them out. Whether that ultimately translates into slowing down the disease or not remains controversial. In some ways, if there is a way of removing these proteins out of my brain, I would prefer that rather than keeping them in. But at what cost? If there are side effects and there is no real proof that this medicine works, I'm not sure we want to go down that route.